You wanted to know what helps cracked sore nipples most, and the key is getting to the root of the problem and treating it. And in most cases, cracked sore nipples are caused by an improper latch. And so if you're struggling with this issue, I suggest seeing a lactation specialist who can actually watch you nurse one-on-one and make adjustments as necessary to help breastfeeding be successful for you and your baby. If it's not an improper latch, it's possible that it could be like an anatomical anomaly, either for the mother or the baby. And so the pediatrician can assess the baby and see if there's any tongue ties. A doctor can examine the woman's breast to see if there's any anatomical differences that may be causing the problem. And then it's also possible that it could be a fungal infection. All of these things can cause issues. And so you need to get to the root of the problem. But how do you help them heal in the meantime? There are definitely some things that you can do. If just one side is affected, try starting the baby on the unaffected side first and then let them nurse on the affected side second, because they tend to suck more strongly from the first side and a little more gently from the second side, and this will help you until it's able to heal. You may also find that applying ice for a couple of minutes before starting a nursing session is helpful because it numbs the area and makes it more tolerable when you're nursing your baby. If you just find that it's too painful altogether to nurse, then you can pump and feed your baby the expressed breast milk. And if that's even too painful, then you can manually express breast milk. But it is really important to continue extracting breast milk from the breast regularly to maintain supply and also prevent additional complications like mastitis. You can also try changing the baby's position, and this may alleviate pressure on a certain point that's very painful and make it more tolerable for you to nurse your baby. Something that you can try right after breastfeeding is a saline soak. And you can buy saline packets from the drugstore, or you can make your own saline solution. And it might sound painful to put a sore cracked area into a salty solution, but the concentration of salt is minimal and it shouldn't hurt. And you can make your own saline by mixing a half a teaspoon of salt into 8 ounces of warm water. Mix it well and make a new batch each day so that you avoid bacterial contamination, and soak the sore cracked nipples in this saline solution for just a couple of minutes after nursing. And if you find that your baby doesn't like the salty taste, it's okay to rinse it off before you latch your baby on, and they shouldn't even notice it. Ointment may also be applied after using the saline solution, and the ointment that you use is going to depend on the possible cause of the sore cracked nipples. For example, if they're becoming infected, then you may need to use an antibiotic ointment. Or if it's a yeast infection, then you need an antifungal ointment. And there are specially prepared ointments that have antifungal properties, antibacterial properties, and also anti-inflammatory properties in them. And so talk with your doctor about a certain type of ointment that may be very helpful for sore cracked nipples, and they can prescribe that to you if they feel like it would be helpful for your situation. Lanolin ointments can also be very helpful, and you can apply that after breastfeeding sessions. In between nursing sessions, it's good if you can let the breast air dry. So it sounds kind of funny to just walk around with nothing on, but that may actually help. Obviously, it's not possible to walk around topless all the time, and so when you need to put a shirt on and a bra, it can be painful, but you can find good nursing pads, and some of them actually have like a little indent for the nipple, and so those would be ideal. And there are even breast shells that help to prevent the nipple from rubbing on clothing, and so you can look into that if you need those until you start to feel a little bit better. And you can also talk with your doctor about over-the-counter pain relievers. For example, ibuprofen and Tylenol are okay to take while breastfeeding, and so that may be something that your doctor recommends for the pain. A lot of women also have questions about how to wash a sore cracked nipple, and generally speaking, nipples don't have to be specifically washed unless they're cracked, and you want to do what you can to keep them clean. So when you take a shower, use a soap that doesn't have any perfumes or dyes. It's just a very mild soap. Gently wash the area and rinse with warm water, and that should be good enough for it. And then, like we talked about, you can use ice or ointments or medications, whatever you need to do to address the problem. If the nipple seems obviously infected, like if you have a fever or you notice that pus is coming out of it, it's red, swollen, that type of thing, is looking infected to you, then have your doctor take a look too. And they can determine if further investigation or treatment is necessary so that you can feel better and breastfeeding can be successful for you and your baby. Good luck with everything, and if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.